Today we're going to talk about how to choose therapist. This comes up a lot because it's very difficult if you're not in my world to really figure out, and all the stuff that's out there, what is what and what fits best with me. I'm going to tell you at the end of the day, you're going to have to trial some of this. So I'm going to talk about some things you could do to prepare yourself, but at the end of the day, you're going to have to go in and see somebody, see if it fits for you, because your judgment is going to be the biggest deciding point. So let me just start by saying this about the act of choosing a therapist and going to therapy. It is very difficult if you've got a problem to first admit that you have a problem, and then secondly, do some homework on how to get help, and then thirdly, walk in the door. Right? This is actually very difficult to do, and I know this, done this for many years. It's very challenging. So if you get through this, you've already done a lot to help yourself. So I'm just going to go over now some basic sort of things you should be looking for. First of all, if you're living here in Basel, say, you need to look at local resources. You find most of it nowadays on the internet anyways. You can look up therapists, a psychologist, a counselor, or a psychiatrist. You can look them up and refer yourself to them and do it that way. There are lots and lots of online resources. You can decide for yourself whether you want to go into someone's office and see them or whether you want to do online therapy. And if you're doing online therapy, obviously the world is open to you. So that's even more complex, right? So then you have to find someone who speaks your language, who understands sort of the cultural background you came from, and can work with you on this. I can tell you online there's lots and lots of therapy being done right now. So for a lot of people, this is a very convenient way of doing therapy. I've done it myself because we did it during lockdown. Never done it before then. And I was surprised just how well it worked. I wouldn't rule out online therapy. At the same time, the old way of going into a doctor's office or a therapist's office and talking to them also works for some people. So you have to decide sort of the venue you want to have it happen in. So local resources, through the internet, go to your doctor if you have a physician and talk to them about it. They may be able to make referrals. They're in this business as well because they refer most of their patients out, right, who have mental health problems, so they know local resources as well. And the other thing to do is in your own social group, ask a friend. If you've got friends, it's likely that you've got something in common, and so what worked for your friend may well work for you as well. It's just a basic sort of search for a therapist.
I have a question,
Yep.
John. How could they spare themselves from fraud experts? Is there many, if you talk about online experts, and they might be also some frauds.
I'm glad you asked that. You got to look at credentials. So what is the minimum credential you should be looking for? The minimum credential to do psychotherapy of any kind is a minimum of a master's degree. And it should be a master's degree in something that provides counseling. So if I have a master's degree in, say, experimental psychology, it doesn't mean I know how to do psychotherapy. They're two different worlds. So it's either going to be clinical psychology or counseling psychology. In the psychology world, those are the only two that deal actually with patient problems. And you have to look for this credential. So what the credential gives you is you're guaranteed that the person went through school and has knowledge. It doesn't guarantee they do a good job, right? It just means they passed the test and they have the knowledge of how to do it. The next thing you're going to look for is a specialty. Talked earlier in another video about the different categories of psychology, right? So if you're looking for a behaviorist versus cognitive behaviorist versus psychodynamic, humanistic psychology, there's different ones out there. All of this stuff that I'm telling you, you can just Google it. It's very easy. And it'll give you a little, if you go to the wiki page, it'll give you a little blurb on what it is. And then you have to go out and see, well, I think this fits for me. So you're doing a guess, really, right? I think I want to talk to somebody. This sort of thing really appeals to me. So some therapies work more heavily with emotion, and that's more the humanistic stuff, so they deal more with the emotional side. So if you feel you need to unload a lot of emotion, then this may work better with you. The stuff I do doesn't work as much with emotion, it works more with thoughts. It's more scientifically based, it's more thoughts and behavior. I don't spend a lot of time working on the emotional piece, because this particular method, it's seen more as an obstacle actually to getting at the stuff that allows you to change. So you're going to have to look for the subcategories of what they do. If you go to a website or something and they're not saying what they do, then phone them and just ask them, what type of therapy do you do? There's another form which a lot of people use, it's called eclectic, which is just a mixture of all of them. And they put them together because what they're trying to do is trying to fit a method to the person that walks in the door, right? So some people are able to use different skills at different times depending on what works. And in therapy, they will also do it. So if you start off doing it one way, you seem to get stuck, they may try to use some other therapeutic modes from another angle. And that's called eclectic. It's hard going in to see a therapist. And we know that anxiety goes up as soon as you walk through the door. So you have to be able to trust the other person you're talking to. So you need to find someone you feel you can trust. If your gut sense is that I don't feel good about talking to them about, personal stuff, it's the wrong fit. It's that simple. Go find someone else. You also have to be able to open up. It depends on your personality. Some people, they open up and they just sort of gush out and everything flows and falls out. Other people are much more reserved, and I've got to reach in with questions and answers and pull the stuff out because they're not used to opening up. They're not used to talking. But that's part of the therapy, right? Is just learning how to talk and talk about your emotions. So you really have to know a lot about your own self and how you present in the world. Are you an open person? Are you much closed? Are you more secretive about things? Who can you trust? How do you trust? So a lot of people, say with childhood trauma, have an awful lot of difficulty in trust, period, right? That's the thing that got shattered when they were a child. And so they have difficult trusting anyone. But then you know that going in, right? You know that about yourself. This is going to be hard to be able to trust a therapist. So one of the things you're going to need to know is, can you work with a therapist over time to learn how to trust? That's the actual problem. The problem is learning how to trust. So the diagnosis isn't as important. It's this particular problem that's important. If you don't get to trust, you're not going to get to the other stuff, right? So there's different ways of looking at it. Lastly, I just want to make a very practical point, which how much everything costs. There are different therapies out there. Most therapies work on what's called a 50-minute hour. So they give 50 minutes worth of therapy and then 10 minutes to write up their note, which makes up a full hour. You end up paying by the hour. It varies from place to place, from city to city, from country to country, and all of this stuff varies in how much it costs. But you need to sort of do your homework and try to figure out how much will work in terms of your own budget. I think here in Basel, I think right now it's around 100 francs, 120 francs.
Which is fair.
Which is a fair wage, not outrageous. In Canada, where I came from, in Toronto, they were charging 200, 250. It just depends on where you live and what they charge, because there's...
Stay mentally healthy in Toronto.
Yes, that's right. Yeah, you got to stay healthy. It costs too much. And people online will charge different things. They'll charge in euros, they'll charge in Canadian dollars, whatever. So you have to sort of work through your own budget along this line. In terms of how long does therapy take, each model has a different thing, and then of course each individual is different and how much time they will need. Psychodynamic therapy tends to take longer, but from their perspective has greater result on the long haul. The stuff that I do, for example, usually between 6 and 20 sessions, that's usually I can get people back working on it on their own. The objective of therapy is not to be in therapy. The objective of therapy is to be back to life, right? And so it's getting out of your problem. That's really the job, it's change. You also have to look at insurance. Companies will pay for therapy. So look into your own insurance if you have health insurance to see what it will cover, what it won't cover, what type of therapy it covers, how long, how many sessions it will cover. And some therapists do what's called a sliding scale. That is, if your financial situation is such that you can't afford therapy of any kind, then some people will offer it on a sliding scales. They'll drop their payments as low as 50% in order to allow people so they can still get help, right? So that's also available out there. I think overall, when you're choosing a therapist, it's the right fit for you. And that requires you to understand what it is, who you are, and what it is you need, and to be honest about that. People often come to therapy, it fascinates me, they actually want to oppose the therapist, right? So they put up resistance to therapists, even though they're paying for it. They put up resistance, and this is actually quite normal, right? We resist change. If you go in and you meet a therapist and you find yourself resisting, this is normal in therapy, and it is part of the process to learn how to overcome the resistance in order to get through to the other side. If you're coming in and you're seeing a therapist and you just say, oh, I don't think this works, you have to be careful that you're not just resisting every therapist that comes along, right? Because of the fear of change. So you have to be able to come to terms realistically and commit to doing therapy. Otherwise, it's a waste of your money, frankly. You're not going to get much out of it. So just try to remember that it's not just finding the right therapist, it's also preparing yourself for doing therapy. And that alone is a process, right? You don't just wake up one day and say, okay, I'm into therapy. First guy I see, right? It's not that way. You need to go through the process of trying to figure out that you need help and come to terms with that, then doing your homework to find out what it is you need, and then finally going out and trying some therapists on to see what works for you. That's basically how it works. So I'll end here. If you have any questions on this, please feel free to put it in the comments section. It's easy for me to come back to that at a later date and answer those questions, okay? Thanks very much.
So today we talked about many different topics with John McNally, who is a clinical psychologist and coming from Canada. So I thank him for all the information he shared with us. I believe wherever you are right now, in which country you are, all this information, all this support from him will be very helpful. I strongly believe that. And please share your thoughts, your opinions in the comments below so that we can react to that. And if you have any questions for further videos, we will be always reflecting that and answering your questions in the next videos. John is very eager to answer your questions, so please put some questions which is in your mind and just troubling you, so that we could help you believe, let's say. Thank you a lot, John.
You're most welcome. I just wanted to add to that the whole world of psychology, for people who don't know about it, it's complex, right? It's difficult to figure out. And so please feel free to ask me. I'm more than willing to work through a lot of problems people are having, and I'll just try to explain what it is and what you should do next, where you're sitting. All right? And I just want to say thank you as well.
Greetings from Basel, Switzerland.
Bye-bye.
Bye.
So in this video, we're going to talk about how
Wait, I didn't sit yet.
Okay, wait.
Now.
You ready now?
Yeah.
Should I be looking at you or them?
No, today.
Awesome.